Meet Kopper. Like many puppies, she enjoys sniffing, exploring and chewing. But unlike most dogs her age, this 5-month-old Beagle King Charles Spaniel cross is training for a very important job. She's a therapy dog at the Kadima Neuropsychiatry Institute in La Jolla, which offers advanced brain treatments for people suffering from things such as depression, anxiety and post-traumatic stress disorder. Dr. David Feifel owns the clinic.
A lot of our patients here in the clinic are experiencing new treatments to them, and a lot of them come in a little apprehensive, a little bit nervous, and we know that the better state of mind that they're in, the more effective the treatment is. And I had noticed in previous patients who had therapy or service dogs that when the service dogs were present, either during the treatment or just before, it had a remarkable calming effect on their state of mind.
A big part of Kopper's job here will be to sit with people while they're having treatments to put them at ease. But what do the patients think of Kopper? What is it about Kopper particularly that makes her so good at this?
I started calling her Dr. Kopper after I left because she does a lot for me. She's like a doctor in a way. She just takes care of you. She just calms you right down, makes you forget about what's going on around you, don't you?
What kind of impact is she having on you right now?
Smiles. So that's the best way to start a treatment. Dr. Feifel is right. Going into it with a positive feeling certainly enhances the experience and it enhances the outcome, I believe.
What do you think makes Kopper such a good therapy dog?
Well, she's soft and she's warm. She's keeping me warm. They say that it reduces your blood pressure and stuff being around animals. So,
what difference does she make to your mood when you're in here waiting for treatment?
It's definitely has a positive effect. It's just relaxing. It also is just a good distraction. It kind of takes you out of the medical setting too. Like it just kind of removes that whole white coat syndrome thing.
Mary Feifel is the Chief Financial Officer here, and you're also Kopper's trainer.
Yes.
So tell us how Kopper's going.
She's doing really well. She's very food driven, so anytime we ask her to do something, we reward her with a treat, and she complies.
Okay, could you give us a little example of,
Yes.
of how that goes?
Kopper, sit. Good girl. Lie down. Lie down. Good girl. Good girl. Stand, but
That was really good.
Yeah.
We have a form that patients fill out at the end of their treatment to describe what they've experienced, and it's on a couple occasions now people have cited Kopper as being an enhancing part of the whole experience. So we know that she's already earning her keep.
Kopper still has lots of training ahead of her, but this little dog is already making a big impression on patients here.